In recent years, a trend has developed known as surgical tourism. Patients in need of surgery take a trip to a foreign country where the medical procedure is performed, generally at much lower cost than if it were done here. Members of the medical profession in this country say there can be serious problems with this approach to care. Plastic surgeon Dr. Glenn Brooks, who practices in the Springfield area, came in to talk with me about the concerns he has over surgical tourism.
Well, my basic concern is the patient's health and welfare. Patients go elsewhere for surgery, and frankly, you'd like to know they're going someplace safe, and that's mostly the case, sometimes the case, and I'm not sure that's always the case. And they come back to the United States having had their care, and maybe they have a problem, and who do they go to? That's the real issue.
Lots of questions I want to ask you along that line, but got to ask you, all due respect, some people will say, well, of course, an American physician affiliated with American hospitals is going to question surgery elsewhere, especially in a third world country. It means a loss of income for the local healthcare operation, threatens your practice. What do you say to someone who says that?
I think clearly people shop around for cost, and cost becomes a factor. A lot of these companies actually include travel with it, and people think they're going on a vacation, but most of the time they have this major surgery and they actually can enjoy, the benefits of being on an island like the sun and the snorkeling and things like that because they just had surgery. My concern is their health. And frankly, we see some of these people come back with infections, with other problems, and we're taking care of them. A lot of times they can't even find a doctor because no one wants to take care of someone else's patient or the problems associated with it.
Mm-hmm. I was fascinated by the numbers. 750,000 people, according to the Center for Disease Control, 750,000 Americans every year go abroad for medical treatment. Again, it's mainly cosmetic or dental, but I saw major surgeries, heart, some other really major procedures included. People are making really life and death decisions.
Yeah, and in my case, the cosmetic surgery may not be life and death, but it certainly has some risk. And the risk is not just associated with the surgery, it's associated with the travel as well.
Let's go down through a list of questions the medical establishment in this country does raise about surgical tourism. Hard to evaluate the credentials and accreditation of both physician, surgeon, medical facilities where you're treated other than this country in many cases.
Right, and that's one of the interesting things. I have several friends who were trained in America, board certified in America, and now practice in other countries. And there's a comfort level with those people because we know what their training was. When you have someone who's trained outside of the United States, the American Board of Plastic Surgery has not been the one that certified them. They work in a facility that has no accreditation process. You don't know who's checking out for whether they have a high infection rate, the cleanliness, the sterility. That becomes more of a concern. And again, patient safety is number one in these cases.
I want to pick up on something you mentioned a minute ago. And you said, maybe a cosmetic procedure isn't the biggest worry in many cases, but it seems to me every surgery, any invasive process or procedure, even a removal of a tooth, you're opening the body up, there's a risk.
Right, and in point of fact, the risk starts to increase because of the travel, and that's what I was alluding to before. Patients fly down on a plane, and we always talk about people getting blood clots in their legs, DVTs, and the risk of a pulmonary embolus, the blood clot traveling to the heart, lung, or brain. And that's increased with just the lack of walking around, your legs being stationary, bent position. That happens on planes alone. If you add to it surgery where a day or two later, they're now on an operating table, flat, asleep, not moving around, that risk goes up greatly. And so the risk, that becomes a life-threatening risk. The potential to get a blood clot, DVT, pulmonary embolus. So life-threatening things can happen, even infections can happen because of these surgeries, which we consider elective, cosmetic, maybe not as invasive as some others, but the risks are associated with some of these complications.
You mentioned that in many cases, companies aligned with travel agencies, whatever, maybe often in these foreign countries, sometimes government-run ministries of tourism are behind this, put together a package for you, your hotel, pre and post-surgery, if you will, and there are all kinds of activities planned that would be part of a normal vacation. Maybe you aren't really up to that.
Right, well, and you shouldn't be. After most of these surgeries, you shouldn't be out in the sun. You shouldn't be raising your heart rate or blood pressure. You shouldn't be so active that you're causing some risks to the work you just had done. And some of these, if you talk about like a tummy tuck, those patients really aren't moving around a lot for a week or two. And sometimes they're back on a plane at 10 days or 2 weeks when they haven't even barely started their recovery.
And you went into plane travel, as you mentioned. If you're sedentary for several hours, there's a risk of blood clots. I know people Now, if you're in a hospital for a surgery in most cases, and you're going to be sedentary for even a fairly short period of time, and they used to have the pressure socks. Now they have these actual sort of machine, which are just fascinating to keep, the blood moving.
At a bare minimum, we have these sequential TED stockings that help milk the blood up. But many patients are also getting a slight blood thinner before surgery just because they're going to be on the operating table for a couple hours in the United States. Again, if you're traveling, that risk increases. If you're on an operating table in a situation where we don't know how reliable the ambulatory surgery center is, the risk increases as well.
And in fairness, there are many wonderful physicians and staff, technologists all over the world, many good clinics and hospitals, but we know that's not always the case. And we know the United States government, maybe sometimes to a fault, because it can sometimes be difficult to get a medicine or get a particular treatment because they're so tough and so strict here, the FDA and the CDC, about who can do what, where it can be done. You're not facing that overseas usually.
Not so much, but just like I would encourage you in the United States, if you're going overseas and that's important to you and you have a friend who did, then do the same thing you do here. And I try to encourage people here to do it as well. Find out who the doctor is. Are they board certified in the specialty that you're interested in? Find out about their facility. Find out how they were trained. Ask how many of these procedures they've done. Ask what their risk factors are and whether they've had problems with it. I mean, you should know all that information. It shouldn't just be a phone call to set up an appointment, never even meet the surgeon until you get there and not have any idea of all those details.
And you hate to think of it this way, but if there are some kind of problems with your treatment, post-operative, infection, or whatever it might be, you're probably beyond the protection of any U.S. law.
Right, exactly. No U.S. law applies to anything that happens down there. So, the care, the post-treatment, the concerns about that, it's left behind there. And many of these patients come back, they end up in the emergency room because they have nowhere else to go. So again, I think if someone's going elsewhere and they're committed to that, I can't always stop everybody and say, stay here, go to a qualified plastic surgeon here. Find a plastic surgeon here who's willing to see you afterwards. Don't just come back 2 weeks after surgery and never get another follow-up. Somebody will be willing to take you on, and if you meet them beforehand, you're more likely to get adequate follow-up than if you're calling afterwards when you have a problem trying to find somebody.
The reason people do this generally is economics. Mm-hmm. Costs are lower in many foreign countries, especially third world countries. And I'm not going to, I did see some numbers quoted in some articles. I'm not going to do that because it's different in every case. But in some cases it was a third or less for some, procedures I wouldn't want to have done somewhere I didn't know really well. Right. But if it's the only way someone can get it done, maybe they may think about it. But I know it's been pointed out by medical folks in this country, you may end up with no savings in real dollars if you have some of these post-treatment problems and you need repair and rehospitalization.
Right, and it actually may cost more. I mean, and beyond the risk, which I don't know what you put a number on for the risk, but the actual cost may be more if you come back with a complication and then you're trying to find somebody to take care of you. You end up in the emergency room or the hospital with the repeat surgery. Or just fixing up problems that were not perfect. It's more likely if a doctor operates on you, especially for cosmetic surgery and things aren't perfect, they can do their best at minimal cost to try and make things better. But if you're here and you have the surgery elsewhere, it's hard to find a doctor who's going to be so sympathetic they want to give away the surgery to help you out. I get it, we all have big hearts, but at the end of the day, you're coming to them as a stranger and they want to help you, but you're going to have to probably pay something to get that taken care of.
Well, Dr. Glenn Brooks, thanks for your time. Thanks for coming in to make us aware of a problem a lot of us, I'm sure, weren't aware of.
Thank you for having me.